Hello, I'm Nicola. I'm one of the midwives here in the Rotunda Hospital, and today I'm going to talk to you about pain relief options. In the hospital, we can offer you pethidine, Entonox and the epidural. What is pethidine? Pethidine is given by injection. It is a synthetic opioid pain medication. It's available from the early stages of labour, from when your cervix is less than 4 centimetres dilated. It lasts about 2 to 4 hours in your system. It's given as an injection in your leg, and it's also given with an anti-sickness medication. It was notorious for making you feel nauseous and feeling sick, but now that has been corrected by adding an anti-sickness medication with it. It does pass through the placenta. It will dampen your feeling of your contractions, but it won't get rid of them completely. The most women who get the benefit out of pethidine is for women who are at home for a day, maybe into the second day, they're with their contractions, they're on their ball, having their baths, having their shower, and they come in very tired. We would then recommend as midwives to come in, get the pethidine injection, and that will give you a few hours of rest. So concerns women might have. We know it passes through your placenta and it may cause drowsiness. Therefore, we have parameters in place to keep things safe. So we would make sure you are given the correct dose. So therefore, your height and your weight is calculated for the dose. We also then would ask with your consent to do a continuous monitoring of 20 minutes of your baby's heart rate to make sure baby is good at that time. We also then would ask if you were already admitted to the early labour ward and you're after being walking around, having your bath, having a shower, and then when you ask the midwife for the pethidine, she might ask, could she, with your consent, examine you because you might have progressed. And if you are 3 centimetres or more, you will be offered to go over to the labour ward. But if you're less than 3 centimetres at that time, yes, it is safe to give you pethidine, and the midwife will get the obstetrician to chart it and give it to you. So the Entonox gas, what is the Entonox? Well, Entonox is 50% oxygen and 50% nitrous oxide. It's very suitable for when you're 3 centimetres or more. It's immediate acting, and you can use it when you're in the bath, when you're on your birthing ball, and when you're using your TENS machine. It does pass through your placenta, but it does have no adverse effects on your baby. Just like the woman in the picture, you breathe in and out in the tube from the start of your contraction to the end of the contraction. And like very similar to the pethidine, it will dampen the feeling of your contraction, but it won't get rid of it. So as I said, the benefits of the Entonox gas, it's immediate acting from when you start using it. You can keep moving, standing, walking around, using it with the TENS machine, the bath. And what can happen to you when you're taking it? Some ladies report they get the fit of the giggles, they start laughing. Some ladies report they get a little bit nauseous or dry-mouthed. So these are the side effects, but they do settle down, usually between 10 and 15 minutes. So don't knock it till you try it. It is very effective when used properly. The epidural. What is the epidural? The epidural is a regional anaesthetic block. It's only sited by an anaesthetist. It's designed to block your discomfort completely. It's suitable when the cervix is 3 centimetres or more dilated, and you cannot walk around anymore once you get that. You can only get the epidural when you're on the labour ward. So the benefits of the epidural is it's working well after 20 to 30 minutes. It can take up to that to start working. It aims to provide complete block, removing any discomfort and any pain from the top of your belly right down to your toes. You will be able to move when you get the epidural. You'll be able to go on your left side, your right side. You'll be able to sit up, but you won't be able to walk. You might still feel pressure when the baby is coming, but you won't feel pain. So the concerns women might have with the epidural, you will be staying in the bed, you will be no longer mobile. And because you're staying in the bed with your consent and when you are pain-free, we ask as a midwife, can we put in a tube into your bladder? This is called a catheter. As you already know, it's very important that your bladder is kept emptied, and that's what this does throughout your labour. Also then, an IV line will be put into your arm, just like the lady in the picture there, and that's to give you fluids. You will also need continuous monitoring once you get the epidural. The associated risks with the epidural is 1 in 100 women can develop a severe headache a few days after they get the epidural. This is called the post-dural headache or epidural headache. Also, it might not work the way you were hoping. That's called a patchy epidural. But the anaesthetist then will stay with you until that is sorted. 1 in 100,000 women may experience nerve damage. So the epidural procedure, what happens when you want the epidural? So when you come to the labour ward, you will tell the midwife at any stage when you want the epidural, and the midwife will call the anaesthetist, and the anaesthetist will come to the room and talk to you about the epidural and get verbal consent. They will also describe the procedure to you. The midwife will put in an IV cannula for the fluids. If it's not already in, the anaesthetist can put in an IV cannula. And your blood pressure then will be checked more often after you get the epidural. You will then be assisted into the epidural position, and just like the picture on the slide, instead of you sitting in the middle of the bed, you will be assisted to the back of the bed where your bum is at the edge of the bed near the anaesthetist. You will be given a pillow to hug. You will hug the pillow and you will be in the correct position then for the anaesthetist to start. Your back will be sprayed, and this will keep your back sterile for the anaesthetist. Then a plastic drape will be put over where it was already sprayed, and then the anaesthetist will sit down at your lower back and feel with their thumbs where the correct position is for them to give you the local anaesthetic, and then to follow on from that, give you the needle for the epidural. Once they have located the space, they will inject local anaesthetic to numb the area. After waiting a few minutes then for that to numb, they will continue with the procedure. They will insert a needle into your back, and then in the needle they will feed a small thin tube into your back, into the epidural space. Once it's in there, the needle is removed. The tubing then is taped securely on your back, and it will come over your shoulder and sit here in the front of your shoulder. From there then, it will be connected to an infusion pump that is beside you in the bed. Attached to the infusion pump is a patient-controlled little button. And if you feel pain at any stage throughout your labour, you can press that button and give yourself a top-up. You can't overdose on it because it locks out. Otherwise, the infusion pump will every 40 minutes give you automatically a top-up of the epidural. So once all that is connected, you will be assisted into position on the bed. Just like the previous slide, the lady was semi-recumbent, sitting up, the continuous monitoring is put back on, your blood pressure will be checked every 5 minutes, and we let the epidural kick in. It can take up to 20 to 30 minutes to be fully effective, but with each contraction you get, it will get less and less and less. The epidural stays in until after your baby is born. That's when your epidural will be removed. Those were all your pain relief options for labour. You can also find more information about these options on labourpains.org. Thank you.